collecting specimens. Two of the criteria have not been met. Social distancing cannot be maintained in a barber shop, in a beauty shop, or in a nail salon. The governor, in addition to rescinding the shelter-in-place order, essentially precluded your local officials from taking action to protect the citizens of this community. A community where 15 funerals were held this last weekend, where 5 deaths will be reported today, and more than 30 patients are struggling for life with the assistance of a ventilator. I pray that the number of Georgians who are infected and die will not increase significantly in the coming weeks as a result of the lifting of these restrictions. Thank you.
Thank you, Mr. Mayor, for your comments. I'd like to now bring up Dougherty County Commission Chair Christopher Kohelis for some comments. Mr. Chairman.
Thank you, Chief. Thank you, Mayor. As always, I want to begin by offering my most sincere condolences to the more than 100 families that have lost loved ones during this crisis. We understand that we have suffered a tremendous amount of loss in this community, and we know that there will be additional deaths. And that's, frankly, one of the harsh realities of dealing with the pandemic at this time and of the nature that we're dealing with. Yesterday, the governor made announcements with respect to the entire state, and he gave a direction on what is going to happen and what is not going to happen. First of all, I want to say this, and I'm going to go off course for a second. This is our problem. We've got here, and just being very frank and real with everyone, the governor is allowing some businesses to come back online. In reality, they're going to have to comply with a whole bunch of different rules to even operate. And there are going to be barber shops, nail salons, massage therapists, gyms, things of that nature. And then on Monday the 27th, we're going to see restaurants reopen. Here's the reality. We have to dictate our own destiny. Those businesses can come back online. And I understand, a lot of people are truly going bankrupt. And I also recognize that causes other safety issues. Frankly, the ability to feed your kids or not. That's another component. And it's a complicated thought process and a complicated series of decisions that have to be made. But the rules that have been dictated by the governor apply to our community as with every other community. Here's what I have to say to the people. Just because you can do something doesn't mean you should do something. Just because you can go get a tattoo doesn't mean that you should go get a tattoo. Just because you can go and get your nails done doesn't mean that you should. For the businesses that are going to be coming back online, and I understand and appreciate the tremendous, devastating financial losses that you have had, many of you struggling to feed your own families. I get that. Please also know and understand that there are tremendous restrictions on how you have to operate. And we're working to get that information from the governor's office. I don't know what all of those restrictions are, but there are going to be increased sanitation requirements. People are going to have to wear masks. You're going to have to do certain things. You have to maintain social distancing. Also, it's important to understand this. Shelter in place still exists. Shelter in place still exists under the governor's order. If you're not going out to do essential business, stay at home. It's a very simple thing. If you're not engaged in essential business, stay at home. Just because you can go to TGI Fridays doesn't mean that you have to go to TGI Fridays. And I would ask every citizen to think about things this way. Is it a good decision or a bad decision for me to expose myself and my family to other people? And I want to create a picture here. Like, think about, like, it's going to be a difficult environment for any business to operate in this fashion with all of these rules. And there are a lot of rules. Like, I mean, restaurants, you're going to have folks 6 feet apart, at least. I've already heard about some of the gyms in town removing the majority of, or large majority of their equipment so that they can be 6 feet away from each other. So, like, this is a very complicated world that we're going to be living in on a moving forward basis. And I want to say to the community, we've got to do certain things. 1, continue to shelter in place. 2, don't make dumb decisions. Don't go out unnecessarily just because, and I think a lot of people assume, well, if you take, the cap off of the toothpaste, all the toothpaste is going to run out. Well, guess what? We're the toothpaste. We determine whether or not we run out of the tube or not. If you can stay at home, stay at home. This is a very simple message. Just stay at home. If you need to go to the grocery store, go to the grocery store. If in the upcoming months you want to go and shop at a restaurant, well, then determine if that restaurant is engaged in best practices. Determine whether or not those folks that are working there have masks, have gloves, whether or not they've taken the steps necessary to meet all of the CDC guidelines, make sure that the tables are 6 feet apart, and then think for a second whether or not it's a good idea or a bad idea to take your family out to a restaurant. And understand that the context for our analysis is different than a lot of other communities. Now, in some ways, people have been very upset because we had such a large dose of the infection right at the very beginning. And we did. But we've also weathered a lot of that storm. We have begun to flatten the curve. And that's a very important thing in our community. And I have a slide up here, and it's some University of Michigan modeling. I want to explain to the people what we've done. So we peaked at a particular time, which we think was around April 16th. Anywhere from April 11th through the 16th was the peak. If we stop social distancing, if we stop sheltering in place, if we stop wearing masks, if we stop good hygiene, then what will happen, what we know based on the modeling that we have available to us, deaths will rise, we'll have a tremendous resurgence in the infections, your hospital will become overrun. The resources there have been stretched very thin, but we have managed thus far. And we're very thankful for the partnerships that we've gotten from other hospitals. We're very thankful for the resources that the governor has made available to us, which have been very significant. And I want to say thank you for this. We got literally from the Department of Health and Human Services, from the federal government, a 38-member team of medical professionals that literally came in to work with Phoebe and to relieve many of our tired and exhausted healthcare workers. That's a huge asset. We, as Mayor Dura mentioned, on Friday, we're going to have the National Guard here. We're going to have testing available for the public. I agree. Like, we do need to get some more information relative to what is the strategy relative to contact tracing. We're working on getting those answers for you. But we are getting a lot of resources. We're asking a lot of questions. I don't have all of the answers about what the governor's order means today. But what I do know is this. We've got to make good decisions. Just because somebody says you can stay up till 10 o'clock at night and eat a whole bunch of cookies doesn't mean that you should stay up till 10 o'clock at night and eat a whole bunch of cookies. It's just reality. And we're not children. We're a group of citizens and informed adults, and we have to make decisions on our own. If you're elderly or you're in an at-risk health group, guess what? Just stay at home. Stay at home during this time. Let's see this storm continue to settle. We need to let this storm continue to settle. We need to continue to push our numbers down. We've done a very good job. And I'm going to say this. We're ahead of a lot of other communities that are now beginning to see an explosion of cases in their town. Thomasville's starting to see it. The city of Tifton's starting to see it. Other areas around the state are starting to see it. And frankly, I have to say this, part of our reality is shaped by the fact that we have more aggressively tested in Albany than anywhere else in the entire state of Georgia. Therefore, we have more data, we have more positive cases, and we have a better understanding of the number of people that have actually been infected as opposed to those communities that literally have a sleeping giant. So what we need to continue to do is exercise best practices. Continue to make smart decisions. Continue to wash your hands. Continue to wear masks. And let me say this. Our business community, if your workers deal with the public, like you own a grocery store, you operate a grocery store, it is absolutely unacceptable and irresponsible for your workers who are handling cash, who are communicating with the public, who are working with the public, to not have masks. It is unacceptable. It is reckless. I went to Publix the other day, saw none of the workers there wearing masks. That's unacceptable. Absolutely unacceptable. We know that masks work. And I thank the business community. I thank Publix for doing the many other things that they've done. But you know what? We got to do better. We have to lead by example. Grocery stores, have your people wear masks. If your business deals with the public, wear masks. Have hand sanitizer available. For those businesses that are going to be coming online, I'm going to say this. We are going to enforce strict compliance with all 20 points of the governor's order. And I'm not saying that to discourage anyone from doing business. I want everybody to make $1 and to be able to feed their families. I get that. But we're also going to have to do the basics. You got to social distance. You got to make sure that you're wearing PPE. If you're in one of those professions that requires PPE, I mean personal protective equipment, masks. Make sure that you're engaged in high sanitation, quality sanitation practices. This is, what's been astonishing to me throughout this entire process is that everything that your mother, your grandmother told you when you were young literally applies to this. Wash your hands, don't eat after other folks, don't drink after other folks, don't sneeze on people. Just be clean. And you know what? Our business community can do that. And I'm going to say this. It's not for me, and I will say this. The governor has to make tough decisions for the state. And we're thankful for the hard work and the many resources that he has continued to give us. What I do know is this. We have to dictate our own destiny through our behavior. We can, as citizens and as people and as community members, decide what we're going to do and we're not going to do. And I charge each citizen in this community to literally pause before they make any of these decisions or before they take to social media and they rant and rave about what's right or what's wrong. Just make good decisions. Make strong decisions. That will determine whether or not our strategy is effective or not. Thank you.
Thank you, Mr. Chairman, for your comments. We'll move to our update from Phoebe Putney Hospital. We have two presenters today. First, we'll hear from the president and CEO of Phoebe Putney Health Systems, Mr. Scott Steiner. He will be followed by Dr. James Black, who is the medical director for emergency medicine at Phoebe Putney Memorial Hospital. So first, Mr. Steiner.
Thank you, Chief. Thank you to Mayor Duro and Chairman Kohelas. Both of their impassioned pleas to do the right thing is something that we would absolutely go along with. We, so far this week, Sunday, we had 7 admissions of patients that were positive for COVID-19. Monday, we had 8, and today, so far, we've had 8. And so these represent 23 people, 23 neighbors, 23 family members that a week ago contracted the virus. They didn't contract it 4 weeks ago, 6 weeks ago, at a funeral, at work, or anywhere else. They contracted it in the last week. And probably just a few days ago, they didn't know, right? They didn't have symptoms. They thought they were okay. If you would have said, hey, you're going to be in the hospital next week, maybe some of you are going to be fighting for your life, they would have said, not me. It won't happen. Yet here they are. So while we are seeing positive trends at the hospital, and we're encouraged by that, and we want you to hear that what we're doing, the social distancing, the wearing of masks, the restrictions that we have are truly working. They are saving lives, but we're not there yet. We're not able to claim victory. So we have. We want to make sure that these prevention tips, they really haven't changed. And to the mayor and to Chairman Cohilas's impassioned pleas, everyone needs to be in a mask. We believe that as healthcare professionals, everyone needs to be in a mask. If you're working, if you're here in this room, if you're at the bus stop, if you're on a bus, wherever you are, you need to be in a mask. There are countless videos on how to make your own mask. If you have a t-shirt at home, you can make your own mask. If you have a bandana, if you got some rubber bands, anything and everything can be used to make a mask. Please do that. No matter where you are, be in a mask. Wash your hands. As Chairman Cohilas said, it's what your mother, grandmother always taught you. Wash your hands once, twice, 3 times an hour. Even if you're just sitting there thinking about it, pull out the sanitizer, disinfect your hands. Avoid touching your face as much as possible. If you have to touch your face, wash your hands before you want to touch your face. You scratch your nose, wash your hands. Socially distant, right? Continue that social distancing. Don't congregate, right? 6 feet, 10 feet. No handshakes, no hugs, right? I understand everyone's a social being. That time will come. We'll be able to do that again, but we're not at that point yet. And then disinfect any surfaces that you can as often as possible. We believe this, along with other strategies, will get us to where we want to go, which is returning to life back to normal. So we appreciate everyone's cooperation. We are very encouraged by the trends that we're seeing. We want to see those continue down, and not like that diagram that we saw where we launch back up and see a second surge that could even be more deadly than the first. So we thank you for that.
Good afternoon. I'd like to give an update on the numbers. Our most current numbers show us they have tested over 6,000 people. Currently, we have 2,113 that have tested positive and 3,921 that have tested negative. We still have 145 tests that are pending, and you'll see that number has decreased over time as our testing has improved and the turnaround time has improved. Currently, there are 130 COVID patients in the hospital, and our current cumulative total number of deaths across the system, not just in Dougherty County, but the ones that have been under our care has totaled 88. The hotline continues to get several hundred calls a day, over 14,470 total, and we've tested 2,700 people so far using a drive-through screening. The trend over the last couple of days has been that we've seen fewer admissions by a couple on a day, so a slight downward trend. It's encouraging, and we're happy to see that, but we are not done. As we are all aware of the lightening of the restrictions that are coming up, it cannot be underscored enough. We should still maintain our social distancing. Leave the house only if you have to. If you must go somewhere, make sure that you're always wearing a mask. Try to only patronize businesses where everyone else is exhibiting those same behaviors, wearing masks, wearing gloves, frequent hand washing. Wash your hands frequently. Don't touch your face. Try not to congregate in large groups. It only takes a gathering of people with someone who's unaware or you're unaware that they may be infected for this to spread and for us to have another spike. It is not that hard to do. We may have been early on seeing a bunch of cases, but the communities around us are seeing a tremendous uptick in number of cases. Traveling out of town is not necessarily advisable. They're having a lot of cases there. We're also seeing, whereas over the past few weeks where we were needing to transfer patients out because of the tremendous uptick, we're now beginning to receive patients in from the surrounding communities as their hospitals filling up. There are cases all around the state, all around the country. Stay home, maintain the social distancing, shelter in place, unless it's absolutely necessary. Thank you.
Thank you, Dr. Black, Mr. Steiner, for your comments today from Phoebe Putney Memorial Hospital and the system. I'd like to move now to the Southwest Health District. The director, Dr. Charles Ruiz, is here, and I'd like to bring him up for some comments. Dr. Ruiz.
Thank you, Chief. The governor is strongly encouraging and promoting more testing in Georgia and also contact tracing. I'd like to talk about both of those, and we very much are following the governor's lead in those efforts. Currently, we have 3 locations for specimen collection in Southwest Georgia. Those are in Daugherty County at the Health Department on South Slappy, in Thomasville at the Health Department, and in Mitchell County. We just opened up the Mitchell County collection site today at the First Baptist Church there, and we had one in Miller County, and after a week or so, we decided it would be better from a strategic standpoint to move that over to Mitchell County. Those 3 locations are all open 5.5 days a week on Monday through Friday, 8:30 to 5 p.m. on Saturday, 9 a.m. until noon. We are doing those currently by appointments only, and it's easy to make an appointment. The telephone number is 229-352-6567, 352-6567. That line is open 6 days a week. Currently, anyone with symptoms consistent with COVID-19 would be eligible to be tested. Adults 60 years of age and older are eligible. Anyone who is a caregiver for someone who is 60 or older is eligible. Caregivers for immune-compromised people are eligible. First responders are eligible. Healthcare workers are eligible. People with serious medical conditions, including heart disease, diabetes, lung disease, and immunocompromised conditions are all eligible. And anyone who lives in or works in a congregate setting are all eligible for collection. And it has been said before that we do expect the National Guard to be here in Albany starting this Friday to also perform collections. We don't know all the details about that, but it sounds like they will be there all day long, and it sounds like it will be 7 days a week. By the next press conference that we have, I believe we'll have all the details. It is our understanding, as the mayor said, that no appointment will be necessary to have a specimen collection through the National Guard. So it will complement what we're doing here through public health. And we're excited about that happening. The National Guard has already been with us in a support role for the last 2 or 3 weeks, and that has helped us tremendously. So testing is being ever expanded as the days and weeks go by. It's much easier to access, and the turnaround time likewise is improving. I'd like to say a word about contact tracing. Part of routine public health involves a staff of epidemiologists who keep up with communicable diseases. And one of the things that they do on a routine basis is when people develop certain contagious illnesses, such as HIV and other sexually transmitted diseases, what we do is notify the patient to make sure they understand what they have and what they can do to have the best possible outcome. But because it's communicable, then we do a survey to find out who else in the community might have been exposed. So we are, in public health, we're accustomed to doing that sort of thing. And that's something we have been doing for COVID-19 since the very beginning. Initially, when the numbers in the community were relatively small, it was not so much of a stretch to contact everyone. As the prevalence in the community built up, then it did stretch us a little bit, and so we brought on more staff to work with that problem. We repurposed some of our other staff. We essentially pretty much doubled our staff working with epidemiology to deal with the problem. We plan to hire and to train more staff over the next couple of weeks. We believe that we will have help from a variety of places, including students at various universities throughout the state to help us. There will be some technology that will soon be used to help us become more efficient in tracing. And so bear in mind that calling up one person to report to them the results of the test is not a terribly time-consuming affair. But then when we interview the patient, we found out who else might be exposed in the community. That can be fairly time-consuming. It's something that we are charged to do, and we're happy to do it. But it's not always a quick and easy step. That's why we've added more staff, and we will be adding more. We intend to do our job and to do it well. So here's some things that we would ask that the community do to help us in contact tracing and in an effort to make sure everyone knows if they are affected or potentially affected. The governor has given authority to the Department of Public Health Commissioner, Dr. Kathleen Toomey, to impose certain requirements on the public. And one of those requirements is that if you are told by a healthcare provider that you are infected with COVID-19, it is your responsibility to notify everyone that you are aware of who has been exposed to you in the preceding couple of weeks. When we call someone to notify them of their results, it is very important that they answer the phone. And we probably all get strange phone calls. We look at the number and we don't recognize it, and sometimes we elect not to answer it. Let me urge you not to do that until this pandemic is under control. If you have had a test, that call very well could be from public health. We need you to answer that phone so we can convey important information to you. And then if you happen to be a victim of COVID-19 and we make that call to you, it's imperative that you give us factual information. We're not trying to persecute anyone that is infected or anyone that might be exposed. We're here to help. So if we make that call to you, we need you to give us factual information and complete information to the best of your ability. Finally, if you've had a test and if you have not heard from us within 5 days or so, it could be that we've already tried to reach out to you and we were unsuccessful. So if you've had a test through public health, please let us know. If it's been 5 days you haven't heard, just call your county health department. And I'd like to echo again the things that have been said. They're simple but so important. Social distancing, wearing a facial cover when you are out in public, and great hygiene when it comes to coughs, sneezes, and keeping your hands clean. Thank you.
Thank you, Dr. Ruiz, for your comments and updates today. We will now hear from Dougherty County Coroner, Mr. Michael Fowler. Mr. Fowler.
Good evening. At this time, Dougherty County residents that was tested positive and died from the resident of Dougherty County is 102. I had a call on the way over here. We had another one, so it's gonna be probably 103. But right now, confirmed, we have 102. As the chairman have said and the mayor has said, one death is too many. It's just too many. I'm gonna go through the stacks of what I've had for the presentation for your information. As I said, as of today, we have 102 COVID-19 positive deaths. Based on the known address here, 31721, we have a total of 12 deaths. 31707, we have a total of 22 deaths. On the east side of town, 31705, we have 20 deaths. On the south side, southwest side, 31701, we have 45 deaths in that location. We have a total of 54 females. We have a total of 48 males. Breakdown of that. We have one Latino, we have 25 whites, and we have 76 black. That's 75% of the population. A breakdown of the gender, we have one male Latino, we have 18 white females, we have 7 white males, we have 36 black females, we have 40 black males. A breakdown of the age bracket, we have no one in their 20s that have died in Dougherty County residents. We have 2 in the age of 30s. We have 6 in the age of 40. We have 6 in the age of 50. We have 33 in the age of 60. We have 25 in the age of 70. We have 21 in the age of 80. We have 9 in the age of 90. We have one unknown. We're trying to figure out their location. Location, we have 2 unknown locations, but 29 of those individuals died in the hospital. 16 died from the nursing home, and 5 died in the residence. The average age of the death is 71. Hebrews 11 chapter in the 1st verse in the King James Version. Now faith is the substance of things hoped for, but the evidence of things not seen. We know Friday, many businesses are gonna be open, also Monday. We don't know what that holds, whether it's gonna be good or bad, but we are hoping for the better to be coming into place. We hope the best. In close, I just want to encourage each of you to have faith. I ran across this quote: faith is not faith until it is all you have to hold on to. And that is where we are here in Dougherty County. We have lost so much, but we must still stand on faith. It is all we have. I don't care if you are white, black, Hispanic, any other race, have faith. If you're from the east side, south side, north side, or west side, have faith. I don't care if you're young, old, positive, or negative, have faith. I'm standing with you in faith. I have faith that God will order the steps of our community leaders, and I have faith in God's promise and His plan. I have faith that He will heal this land, because the truth of the matter is, that's all we have. Faith is not faith until it is all we have to hold on to. So hold on, Dougherty County, to faith. Thank you.
Thank you, Coroner Fowler, for your remarks and presentation. Now we will open the floor for any questions at this time.
I have one question.
Yes.
This one's for the mayor.
Yes, Mr. Mayor.
I know the governor just made the announcement yesterday, of course, but has there been any room for communication on the local government standpoint about some of these concerns that you have, or do you have any plans to kind of address any concerns with him coming up?
Well, I don't have any direct communication with the mayor. I guess the chairman could speak to that, but I do know that there were committees comprised of the Georgia Municipal Association, which represents the cities, and ACCG, which is Association of County Commissioners of Georgia. And both organizations, as I understand, had requested that the governor allow local governments to retain some autonomy in implementing restrictions in their cities and counties. And I assume it's the governor's position that we need to have a uniform order in place.
Thank you.
Thank you.
I have a question for the chair. These are questions just from our viewers. They want to know what's your opinion about reopening. Is this a good decision?
Well, I think what does reopening mean? And first of all, I want to say this. This is not a reopening like we're turning the water back on. One, this is not a decision that was made by either the mayor or myself, one. These are certain businesses coming online. Would I have liked to have delayed that? Absolutely. But I also don't run the state. That was the governor's decision, and he's making that decision. What I'm saying to our community is this, and I think this is an important detail. Shelter in place is not going away. Social distancing is not going away. Sanitation is not going away. And additionally, I don't know, as I stand here today, I still don't know and understand all of the requirements that are going to be placed on these businesses that are being allowed to come back online, because we don't have that information yet. So when you say reopen, it makes it sound like you're opening up Six Flags. We're not, Six Flags is not opening. Certain businesses are coming online, and they've got to comply with 20 different requirements. Would I have liked to have delayed it more before we moved there? Absolutely. But I also don't run the state, and I understand the governor's trying to make decisions for an entire state, and I respect that. And I want to say we're also very thankful for the resources we have gotten. And I think it's easy to armchair quarterback people that are making decisions in real time, and that's hard. I also would have, I like the concept of local control, but I also understand that the governor wants to make decisions that are uniform. This is part of the natural conflict that happens between state and local government from time to time, and you know what? That's what happens sometimes.
I have one more question.
Yes, ma'am.
So for the services that are opening up, the people who have children, what are they supposed to do with their children while they're not in school right now?
Say that one more time, please.
So for the businesses that are opening up and the people who have children at home, what are they supposed to do with their children now that school is not open? Is there a place where they can take their kids or something?
I think you're identifying a very real problem that we're all having to deal with. I mean, I'm going to leave. I did this for the past week. I work from home. I run a business. I'm a lawyer. I call clients. You know what? I homeschooled from home with my kids. And then you have to figure things out as far as child care so that you can go to the grocery store. I don't take my kids to the grocery store. You shouldn't take your kids to the grocery store. I think we're all going to have to get creative, and it's hard on everyone. And you have to count on friends and family in order to get through this. I don't have a magic answer for everyone. I feel you. I got to go to the grocery store too, and I also have to run a business, and I have to homeschool with my kids as well. Thank you.
I have a question for the chairman and
Yes.
chair as well. This is from the Atlanta Journal. Guys can get ready on. enforce the rules in light of the struggles up to now to enforce existing rules?
Say that, read the question.
How can you realistically enforce the rules in light of struggles up to now to enforce existing rules?
How can you enforce the rules?
So I guess, how can you further enforce is how I'm.
Well, it's pretty easy. You send sheriff's deputies with a copy of the order. We've already had a task force phone conference this morning. We've got the Chamber of Commerce that's sending information packets to all of our businesses. We've got sheriff's deputies, police officers they're going to have copies of the order, the 20 different requirements. They're going to go and spot check gyms, massage, places where they get massage, beauty salons. They're going to go and enforce that order, appear, be there, communicate with those businesses, and if they don't cooperate, they'll just get shut down. It's very simple. There.
Okay, I have one more question from the Albany Herald. Just to reiterate, how the new order applies to church services and funerals.
So we're still diving into that and trying to understand that information. And the mayor and I have been speaking every single week with our clergy. And here's what I'm going to say. Just because you can have a church service doesn't mean that you should. And we all know how there were these super spreading events that happened in our community. What I understand so far is that from what the governor's speech was, is that church can happen so long as there is social distancing. And social distancing is an effective way of preventing the spread. I'm just saying, just because you can doesn't mean you should.
Can I speak to that? As I was coming to the press conference, the city manager called and advised me that she had spoken to the staff at both Sherwood and Mount Zion, and both churches had agreed not to hold services in their sanctuaries until May 17th. And I think that's an example of what the chairman was talking about earlier. Just because it's permitted doesn't mean it's prudent. And if we would continue to go the extra mile, then we can overcome whatever difficulties we have with the governor's decision, because if we will continue on the course that we are on, we will come out of this thing sooner and better. And I want to appreciate and applaud both of those congregations and challenge other churches. And the May 17th day, I assume, would have been after the May 13th expiration of the original shelter-in-place ordinance. Yes.
I have one more question for the mayor. For businesses that are opening back up, since people are unable to get cleaning products from the store, will you all be providing cleaning or sanitation products?
No, I don't have any knowledge about that, nor do I expect that the city would have any obligation or ability to provide supplies for a business. But certainly, if there is a problem with supply, we would address that. If it's not accessible to businesses, that's certainly something that should be brought to our attention. And as has been pointed out here before, the state and federal government have been very helpful every time we ask for assistance. And if that is a problem, I know there was an issue at one point in time about paper towels or toilet paper or something, but then there was sufficient toilet paper and paper towels in the grocery stores. Thank you.
As we end today, I'd like to thank all of you for being here. We will see you back here at 1 p.m. on Thursday, as we have moved to Tuesday and Thursday press briefings. So that means our next press briefing will be Thursday at 1 p.m. Thank you and stay safe.
Today we are facing a crisis
like we've never seen before.
And it's up to all of us to fight it together.
We can all do our part.
We can all do our part.
We can all do our part by staying vigilant,
staying safe,
and staying home.
This is our community. These are our neighbors.
And these are the frontline heroes
If we work together, we can get through this.
And grow stronger together.
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 So stay safe.
Stay home.
And stay strong.
If you or someone you care for has COVID-19 symptoms like fever, shortness of breath, or dry cough, call the screening hotline at 229-312-1919 or visit phoebehealth.com/together to find out how you can help keep our community safe.